Hi, I'm Kate Berry and I am the Service Manager for Early Help in Salford, and my role is to support the development of family hubs across the city. So we've got 4 family hubs in Salford. We've got one in Central, West, South and North of the city, but we're also developing satellite sites across our communities. What we are doing at the moment is looking at how do we really embed those family hubs within communities. So we do have a specific family hub that serves our Jewish community within the central locality, and then we're also looking at working with our CVSE sector partners as well. So what we're keen to do is integrate those community services that are running, so that when families come in they don't just see it as one organisation leading the family hubs, that it's a true integrated model between health partners, local authority partners, community, voluntary sector, social enterprises, and that families really feel that when they walk through and into the buildings. We use our family partnership model as our relational practice model, and that's something that we've embedded within the early help service, and also we're starting to do that with our partners. They're really receptive to thinking about what's the family's strengths and what are the needs and focusing on that. So families can walk into a family hub, they'll find it warm, welcoming, and there'll be a professional there that will be able to support them. One of our strongest integrated partners is our 0 to 19 health visiting service. We have an 8-stage delivery model that's centred on the Healthy Child programme, but pulling in different partners to ensure that families get a wraparound holistic response. So it might be that they're getting a universal touchdown from a health visitor, but actually when that health visitor does a visit, they might identify wider needs for the families that can be addressed either coming through a family hub and accessing universal services, or they might need some targeted support, and that's where it would come into our early help service. In order to sort of really make it an integrated offer, we aligned our portfolio within early help. So within our area, we've also got our family relationship service, and that consists of reducing parental conflict, our parenting service, our family group conferencing, and our strengthening families project, alongside our starting life well service, which is focused on the early years settings. One of the reasons that we've reformed our Salford family relationship service is because our partners were telling us that families had parenting needs, but what families were telling us is they didn't like the term parenting needs because it felt like they were doing something wrong. That was a negative connotation for them. We're in the process of developing our strategy with our wider partners, looking at the terminology and the language that we use to make sure that it kind of focuses on the needs of a family and aligning relationships. So when we're looking at a family, it's what are the dynamics within that family? What does that relationship look like? So it might be that there is parental conflict within that family that's impacting on the children. It might be that they need family group conferencing because actually there's wider family issues that they need support with, and it's not necessarily like a 14-week parenting course that they need to go on. We also get quite a lot of requests for support around mental health. A lot of the work that we do through the family hubs and early help service is centred on that really. It's about identifying who's the best lead professional to support that family and how do they then pull in the right services. But they can only do that if they've really explored with the family what their needs are. It comes from the family rather than a professional opinion, because actually we've got to get beneath the surface of what's going on. Within Salford, parent voice is really important alongside the child's voice. So as part of the requirements for the Family Hubs and Start for Life programme, we have to set up parent and carer panels in each of our localities. In order to accelerate that, we've had a wishing tree project that's gone on tour across the localities, and we've been going into each of our community areas and finding out what are the wishes and feelings of the children and young people, and they've been capturing that on like a wishing tree, and that'll be displayed at the Lowry in Salford. And it's been really interesting in terms of what we as professionals think children and young people want versus what they do actually want. Play's been a big theme that's come up from that. So building on that now, we're using our Empowering Parents, Empowering Communities programme, which is a parent peer-led support group, and they meet once every month in each locality. So it's how to make sure that the Family Hub service delivery represents what the communities need rather than it being professionally driven.
Hi, so my name is Kath Kerwin. I am one of the Early Help Locality Managers here in Salford, and today we're sat in the Central Family Hub locality, which is my locality. So I lead on the early years offer across the city from the Early Help service perspective in partnership with the 0 to 19 health visiting team. We focus the visit now on speech, language and communication and the home learning environment for those children and families, guiding families, explaining the importance of early language and literacy, how we can empower them to take the lead with their child's early education and development. The biggest part of that assessment really after the visit is how we communicate that back to the 0 to 19 health visiting team, ready for the child's 2-year check or ready for any other interventions that might need to come from that. Within my role as the early years lead for the early help service, I've worked really closely with the 0 to 19 development nurse, Andrea. So we look at things like standard operating procedures, what tools we use, we look at the data that comes from that, anything that we need to change, we look at how it's working in each locality. It's our responsibility to ensure that across the city that the offer is consistent for every child at 18 months.
Hi, my name's Andrea Mansfield. I'm the 0 to 19 development nurse working for the 0 to 19 Health Visitor and School Nurse Service in Salford. My primary role is around service development from a strategic and operational and service and staff development perspective. As part of my role, I work in collaboration with Kath Kerwin, and we look at all our integrated pathways and how we can work well together. Working with our early help partners, we've been looking at the 18-month pathway. We started working on that pre-COVID and did a pilot in one of our locality areas. And from that pilot, we then learned where it worked well, what didn't work well, what we needed to update.
That was a really, really exciting partnership, great relationships with the 0 to 19 team, learning from each other, developed a competency framework for those early help practitioners based on the community nursery nurses role. But there were clear definitions to each person's role in particular within that.
Once we came out of COVID and we were able to start reintroducing those pathways, we've revisited it, and from that we have updated the integrated pathway. Kath and I work really closely. Kath shares it along early help, I share it out across 0 to 19. We get comments, so we're really collaboratively working across both services to really focus and home in on what we need to deliver for the best outcomes for the family.
I think what's been crucial to this partnership in particular and the integration between the local authorities early help service and the 0 to 19 service is the trust that you build with partner agencies, with ultimately the children, the families in the centre of everything that we do.